Today, we are going to be diving into what I've titled dementia. At the end of this video, you should be able to know the types, the predisposing factor, the causes, and how to support people living with dementia. Dementia, which is usually referred to as brain failure, is an umbrella term for a group of symptoms that affects thinking, social ability, organization, and memory. So let's look at type of dementia. The type of dementia depends on the part of the brain cell which is affected. For today's purpose, we'll be looking at Alzheimer's dementia, which is the commonest, the vascular dementia, the lewy-body dementia, and the frontotemporal dementia. Frontotemporal dementia. This is the part of the brain that controls behavior and our language. So in these people, you are going to be seeing a deviation in their behavior and their speech. Somebody that is able to speak fluently start having slow speech or start having difficulty in speaking. Someone that has never sworn before, you start seeing them swearing. In these people, their memory is still intact. FTD affects mainly people from 40 years and above. So the next one is the lewy body dementia. It's the part that controls thinking and movement. That's why people with lewy body dementia, you see them being placed on Parkinson medication because they have this tremor. Their thinking ability is altered. LBDs sometimes usually exhibit psychosis symptoms. They start hallucinating. And the next one is vascular dementia. Most time, this is as a result of lack of blood flow to the brain cells, especially those that have suffered from stroke. This can occur in any age. And the first symptoms you notice is lack of decision making. They can't plan. The organization skills are gone. And the last one, which is the more popular one I'm going to talk about, is the Alzheimer's dementia. And Alzheimer's dementia is the one that affects short-term memory. They start exhibiting what we call retrogenesis. This is where the Africa misconception comes in. They start living in their early lives. An 80-year-old person, a 70-year-old person start living in their 30s, in their 20s, in their 40s. So when this 70-year-old or 80-year-old person start calling the names of those that were alive when they were age 30 or 40, possibly they are no more, you start seeing people, especially in Africa, saying, oh, they killed that person. So you see that person's spirit is haunting them. That's why they are calling the names of those persons. No, they are suffering from Alzheimer's. They are in retrogenesis. And this Alzheimer's is a gradual process. They gradually lose their memory. Their short-term memory keep wearing away. The biggest risk factor is aging, especially when it comes to Alzheimer's. There's gradual memory loss. Family history. If you have a family history of dementia, there's possibility that you're going to get dementia. Diabetes, hypertension, previous stroke, increased alcohol consumption, head injuries, heavy smoking, lack of exercise. And this brings us to clinical manifestation. They present with memory loss, confusion. They have trouble completing tasks, change in mood and personality. Their movement is affected, tremors, forgetfulness. If you are just joining us, our topic is dementia. Do well to subscribe to my YouTube channel, Nosmile Talk. How do you prevent dementia or lower the risk of early dementia? Be socially active. Read books. Go out. If you have any health condition like diabetes or hypertension, comply with your medications. Listen to your healthcare professional. Eat balanced diet. Engage in regular exercises. Avoid smoking and excessive alcohol intake. Visit your healthcare professional. Go for regular checks. Remember, dementia management is very tasky and difficult for family members. But there are some tips. You have to be patient with them. Show empathy. Have a structured plan for their care. Keep a daily routine for them. And make everything short and brief. Don't complicate issue. Have a structured plan. Encourage them to do small tasks. Label things. Label their room. If it's Peter, put Peter on the door. That will easily direct him. Cup for tea. Dining table. Washroom. Directional clues for them. And remember, their memory, their thinking is all lost or is diminished. They can't determine what is dangerous, what is harmful. You have to make their environment as safe as possible. Safety is the key. If somebody have dementia, you're not going to make a cup of tea that is very hot and leave in their table. You have to make it to that temperature which you know will not get them burned or scarred. Please, most importantly, you need to be alive to be able to support persons with dementia. Caregiver burnt out is very high. Ask for support. Reach out to communities that can support you in managing if you feel you are getting worn out. Remember, early recognition and support slows down progression and give them quality of life. If you notice anything that is new, talk to a doctor. There's no cure for dementia at the moment, but early management makes a huge difference. If this video helped you understand dementia better, hit the subscribe button now, comment, like, and share for more awareness.